Hey guys, so let's look at the factors that affect cardiac output. Now, cardiac output, we know, is gotten by multiplying the stroke volume by the heart rate. All right, so when you multiply the stroke volume by the heart rate, you get your cardiac output. Now, there are three basic stages in or that is involved in cardiac output. The first is venous return, that is blood returning to the heart. That's the first. So let's say venous return. Now the second is contraction. All right. So when blood fills the ventricle, contraction must occur. All right. So the second is contraction. And the third is ejection. So ejection is the resultant effect of contraction. So when the heart contracts, blood must leave the vessel. So we have ejection. Now, look up here. When we alter any of these stages, we automatically alter cardiac output. All right. So altering any of these stages will automatically alter cardiac output. Now let's look at the venous return. Now, what can alter venous return? Let's assume you're exercising, right? And you're flexing your muscles. Your muscles are contracting and relaxing. Now, the contraction and relaxation of the muscles helps to squeeze blood vessels. All right. So when you exercise, venous return is higher. Okay. So the blood that moves to the heart when you exercise is higher. And when the blood that moves to the heart is higher, it will definitely affect your stroke volume. Okay. So that is one. So exercise will affect venous return. All right. Now, the second is, all right, before we go to contraction now, when the blood returns to the heart, the chambers of the heart, it moves from the atrium to the ventricles, right? Now, in the ventricles, the heart needs to relax for it to be filled with blood. Now, there is a certain amount of force. There is a certain force that is placed on the walls of the ventricle. Now, that force placed on the walls of the ventricle is referred to as preload. Okay, so the preload is the force that is placed on the ventricle. So you know when blood gets into the ventricle, it expands, right? So it expands to contract. So that force that is produced when the blood gets into the ventricles, the force that acts on the walls of the ventricles is called the preload. All right. For contraction, calcium ion plays a vital role in contraction, right? So there's what we call the inotropic agents. Inotropic agents, right? And they are both positive inotropic agent and negative inotropic agent. Now, the inotropic agent are agents that will inhibit or support the production of calcium, right? Now, the positive inotropic agent are the ones that will increase calcium. Meanwhile, the negative inotropic agent will reduce calcium, right? And then, associated with this, the positive inotropic agent are the noradrenaline and the thyroid hormones. Thyroid hormones and noradrenaline. Now, for these ones, you have things like calcium inhibitors, and others. Okay, so that is that. for contraction. Now for ejection now, for ejection, when the heart contracts, the blood leaves. Now, the force that the blood places on the walls of the blood vessel when leaving is known as afterload. Afterload. So afterload is the force that the blood places on the blood vessels as it moves. Now, how can this factor ejection now be tampered with? Now, if you have artifacts or growths inside the blood vessels, right, that narrows the passage of blood. What this does is that when contraction occurs and blood wants to go out, there will be a resistant effect. Now, that resistant effect is what we call the afterload. That resistant effect will affect the volume of blood that leaves the heart. So, the ejection now, ejection the process of ejection can be tampered with when you have things like this blocking the inner part of the blood vessel. Okay, so the when the heart contracts and the blood moves out, it definitely will affect the volume of blood that leaves the heart, will definitely affect the stroke volume. All right, so assuming the stroke volume is usually supposed to be 70 mils, and you have this, what happens is that when the heart contracts, the pressure in there will increase, right? And when the pressure increases, the blood has to pass through this narrow passage. And passing through this narrow passage, you may not have the whole 70 mil coming out. You may have just 50 mils coming out. All right. So ejection, when you tamper with ejection, you can tamper with stroke volume, which is the amount of blood that leaves the heart per beat. And if you tamper with stroke volume, you can tamper with cardiac output. So these are factors that affect cardiac output. Right. Thank you, and see you in my next video.